Hello, YouTube viewers. Welcome back to Youthful Medicine. I'm Dr. Tahir. I would like to share with you some important information about a disease of male health, urethritis. Urethritis is a condition which is a sexually transmitted disease, and it causes symptoms in men who have had an exposure, a sexually transmitted exposure to infection, and present to doctors for different symptoms. So I'm going to discuss a case of a 38-year-old male who have had a relationship with a partner for a few months, and initially they were using condoms for protection, but after they became comfortable, they started um, having intercourse without use of condom. And now, in the last 2 to 3 weeks, the patient has developed some symptoms that is concerning him for an infection. So, and the presented symptoms are some pain on urination and discharge, penile discharge. So, these symptoms are concerning for urethritis, which is the inflammation of the urethra, the tube that carries the urine from the bladder out to the body. In men, it can be painful and may cause discharge. One of the common causes of urethritis is sexually transmitted infection. So it is important to recognize the signs early on so that you can be treated. Key symptoms of urethritis include burning sensation in the urine, penile discharge, and itching and irritation inside the penis. Sometimes pain and swelling in the groin region because the infection goes into the lymph nodes can be there, but it only happens if the symptoms have persisted for a long time. So if you avoid delaying the treatment, you may not get it to that stage. So in this particular case of a 38-year-old male with urethritis, most likely due to a sexually transmitted disease from a partner who had an infection, untreated infection got transmitted to him. The most common STDs in these cases that we worry about is gonorrhea, which is caused by a bacterial infection called Neisseria gonorrhea bacteria. The symptoms with this infection start showing up within 2 to 7 days of exposure. The second common infection is called chlamydia. It's caused by a bacteria called Chlamydia trachomatis, one of the most common causes of non-gonococcal urethritis. So, and these two infections can coexist. Sometimes patient has an infection of trichomoniasis, a parasitic infection that causes itching and irritation in the genital region. You can also get an infection called herpes simplex virus, which primarily causes sores. Herpes can also cause urethritis. And Mycoplasma genitalium, a newer and emerging cause of urethritis. So diagnosis and testing is usually based on your history, urine test to pick bacterial or other pathogens. A urethral swab can be done, which is a sample taken from the urethra through in a lab, and also STD panel comprehensive testing, which includes blood testing for gonorrhea, chlamydia, trichomoniasis. The whole STD panel can be done in the urine, and also we also recommend checking hepatitis B, hepatitis C, and HIV. So often, once the case has been presented to us and a suspected symptom with exposure, we initiate the treatment. And it can be further customized based on the results. So the patient gets a test right away. They go within 24 hours to get the test done at a local lab, could be Quest or LabCorp, and then we initiate the treatment right away at the first symptom. First possibility of treatment is better so that it doesn't spread to other. For gonorrhea, we use antibiotics like ceftriaxone, which is an intramuscular injection. If it's not possible, there is a treatment called cefixime, which is oral capsules. You take 2 capsules of cefixime, 400 milligrams, 2 capsules daily right away. For chlamydia, we usually prefer doxycycline to a course of 7 days, 100 milligrams twice a day, and that is usually given to complete the 7-day course to avoid chlamydia infection. Azithromycin was also a drug that we used to use, but with the resistance and overuse of it with azithromycin, unfortunately, it is not our first drug of choice. For trichomoniasis infection, metronidazole or flagyl is a drug of choice, and for viral infections, you will be treated with valacyclovir, which I use most commonly, but acyclovir is also used. So what the lesson we have to use from this is that the prevention of STD and safe practices is important. Prevention is the key when it comes to STDs. So using protection condoms, they are highly effective and reducing the risk of STDs. Number two, getting tested regularly. If you have more than one partner, especially whether you are male or a female, it does not matter. You should get tested frequently. The tests are cheap, usually cost about $100 if you don't even have insurance. And then communicate with your partner that open dialogue about sexual health is good. If you are both interested in using not using the contraception, talking to it and getting a simple test is the best way to get started. Vaccinations, HPV vaccination is important, and younger population who has not been vaccinated should use the vaccine. Avoid risky behavior, limiting substance abuse that can impair the judgment and lead to unsafe sexual practices. And by taking these precautions, we can significantly reduce the risk of these STDs in the community. So at the end, I would say if you found this video useful, like it, subscribe to my channel, share it with someone who might find it useful, and I will continue to produce useful information based on my day-to-day clinical practice and share with you. Until next time, be safe and take care of your health.